Welcome, everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 122,087 confirmed cases of COVID-19 in Canada and 40,646 cases in Ontario. Chatham-Kent has 352 cases and Sarnia-Lambton has reported 336 cases. Michigan now has 92,720 cases, with 13,211 cases being in Detroit. Today, we are reporting 2,424 cases of COVID-19 in our community, an increase of 6 cases from yesterday. 2 work in the agri-farm sector, 1 is a resident in a retirement home, and 3 are in the community. 102 of our cases are currently active and are being followed by our health unit. 2,251 people have now resolved, 91 people are self-isolating, and 6 people are in hospital. 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% of our overall cases are male, and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 2 retirement homes are currently experiencing a COVID outbreak. In addition, there are currently 3 workplace outbreaks, 2 in the agri-farm sector and 1 in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to the wechu.org and click View Your Results to access the online test result portal. If you're unable to review your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us today. Our health unit continues to respond to a high number of questions from the community on a daily basis. With respect to the questions around Stage 3 reopening of businesses, I want to provide some clarification around gathering size in indoor and outdoor public settings. As many are now aware, Stage 3 allows for increased gathering limits of up to 50 people indoors and 100 people for outdoor settings. These restrictions apply to the following space, businesses, or settings: parties, fundraiser, fairs, wedding receptions, and funeral receptions; casinos, bingo halls, and gaming establishments; concerts and live show, including performing arts; convention centers and other meeting or event spaces; facilities for sports and recreational fitness activities such as gym or fitness studios; festivals; recreational attraction, courses and instructions such as fitness classes, music lessons, or tutoring; movie theaters; real estate open houses; sporting and racing events; tour and guide services, including boat tours. It is important to note that in all of these settings, the requirement for physical distancing between individuals does apply. So the limits represent the maximum number of people in a space that is large enough to maintain physical distancing. In addition, an indoor event cannot be combined with an outdoor event for the sake of increasing the group size, and in those cases where a meeting or event has an indoor and outdoor component. The indoor limit of 50 people will apply in all of these situations. There are a number of common spaces, however, such as restaurants, bars, and large retail settings to which the 50 and 100 limits do not apply. And I can understand there may be some confusion in that when we're talking about indoor gathering limit and what the rest of the common space area means. In these common spaces, such as restaurants, bars, and large retail settings, the capacity is simply limited to the number of patrons, guests, or visitors which can safely maintain physical distancing. Bars and restaurants are also required to maintain a log of all customer name and contact information, and not just those who book the reservation. It includes everyone who's coming to bars and restaurants for a period of up to 30 days following the customer's visit to their establishment. This log can be requested by public health in order to ensure that contact tracing can be done effectively as possible if necessary. We have come a long way, and we are all happy to see our local businesses finally getting to operate in this new normal. In order to continue making progress in decreasing the community spread of COVID-19, it is critical that we stay home if we are feeling sick, wear masks in commercial establishments, and maintain physical distancing with anyone who is outside of your household. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
No questions right now, Mike. Thank you.
Okay. CTV?
Just curious, what kind of general complaints are you getting now that we're well into phase 3?
Well, the concerns and complaints that continues to be the mask, the physical distancing piece, and people maybe wearing inappropriately mask and gathering. Those continues to be the key area, and that is why when we are making all these recommendations, we want to make sure that people understand that some of these requirements are a public health requirement that everyone has to follow. But we can only follow that when everyone is complying with that, when everyone is playing their part. As a patron, as a business owner, it is all our responsibility. We all have to do our part to make sure that we're not getting into a position where we're putting lives at risk, where we're putting people at risk of spreading COVID-19. So the concerns hasn't really changed, but it just based on the businesses, we're experiencing more of those physical distancing complaints and masking complaints.
You don't have a number on that, do you?
We do get those numbers. I don't have that in front of me, Bob, but maybe we can send that to you.
Okay, no, it's not like a burning thing that I need to know right now. But another quick question here is: are there plans to expand the commercial or the order? The mask order from commercial and business establishments to municipal buildings and that?
So right now there are a number of municipalities that are taking the proactive measure and doing the things that are under the municipal control. And as we know that the city of Windsor is has put in a mask bylaw. Other municipalities such as Leamington, they also put in a law. So there are municipalities that are taking those actions, and many of those actions are being built on what we have put forward in our section order. And I'm aware that there are other municipalities such as Lakeshore, Amherstburg, they're also looking at it as well. So I think these are all combination of where our jurisdictions, where our recommendations are, and obviously it also depends on the municipality and their own situation as well. So I think all of those good things are happening, and hopefully we are all play our part as individuals, as businesses, as politicians, as everyone, as a community. and we continue to do the good thing to keep ourselves safe from COVID.
Okay, great. Thank you, Dr. Ahmed.
Any questions from Windsorite?
Good morning, Dr. Ahmed. If you've seen this, there's a new Facebook group called Questioning COVID in Windsor-Essex, and they are planning a maskless group shopping trip to Devonshire Mall this coming weekend. The organizer has said, quote, "It's our turn to be the ones who intimidate by being the majority." I'm just wondering what your thoughts are on this kind of a thing, and within the scope of the Section 22 order, is there any way the health unit would enforce this kind of a thing, or that sort of a thing?
So some of these things obviously are enforceable. There are a clear violation of Section 22 order as well as the mask bylaw that a city put forward. And all of these requirements are under the Emergency Management and Civil Protection Act. So it's a blatant disregard of the law. So that's how I would see that. And in the sense of, when we talk about all these issues, we have seen all kind of things throughout this pandemic, people reacting differently to different situation. And we talked about also the overall impact of the economic, social, mental impact on everyone for COVID. So all of these things, when we are seeing, we have to put into perspective. There are definitely anxiety, there are definitely stress. People are anxious for everything that they are seeing. And I would just suggest that, instead of people taking these type of actions or questioning all of this, I cannot tell them what to think, what not to think, but what I can tell them is share the facts. People are dying. People have died. There are millions and millions of people who are infected by COVID. Many of the measures that we are recommending, these are all science, evidence-based decisions. People can do whatever they want in their own personal space. No one is questioning them. But when we are talking about any kind of public space, the rule of the law states whatever is stated. And any disregard to the rule of law, it's basically just a violation of the law, and it should be dealt with accordingly.
Okay, thank you.
Any questions from CBC?
No, thank you. Not right now.
Any questions from AM 800?
Teresa, just looking for clarification. My colleague pointed this out. Under the resolved cases, today it says 2,251. Yesterday it said 2,253. Was there a typo?
So I did hear from our EPI that he realizes those numbers are not reconciling, and he's looking into it. So you're just right on the ball, but we are looking into it. So I reported what I was told through the EPI, but he did acknowledge that they're looking into those numbers because they're probably off. One of the numbers is probably off. So it's not a typo, but it is an error. So that's the explanation.
Thank you. Dr. Ahmed, I want to ask you this on Friday, but obviously the news went a little bit longer. Just your thoughts on what happened in Toronto and the adult establishment. Are you worried something like that could happen here in Windsor-Essex?
Can you remind me that incident, Rob, again, please?
The outbreak that they had at an adult establishment, about 550 people, they are worried that could have come in contact with an employee at the adult establishment.
Oh, yes. Yeah. So I think, again, it goes back to the same principles of what we are talking about in terms of the physical distancing pieces, and especially when we are talking about any kind of performance. We have to be mindful that the physical distancing still applies between the performer and the spectators, as well as even between the spectators. So I think those are the critical pieces. And any establishments, any businesses that are out and about in our community, I think they all have to follow every recommendation that we are prescribing. And it is critically important for the safety and well-being of everyone. So I think we cannot emphasize the fact more and more all the time that physical distancing is the key as we continue to move along with this pandemic, and all the additional measures such as masking, such as like plexiglass or whatever, all these things that we are putting in forward, those are all additional measures. So I think incidents like that will only happen when there is a violation of all those recommendations, and I would strongly encourage all the businesses and all the people in the area to follow that at all time, irrespective of which businesses that they are visiting.
When it comes to the log, and I believe this business in Toronto did not have a log, or they did not do a proper log. If a business here in Windsor-Essex chooses not to do the contact tracing log, what could happen to that business?
Well, this would be a violation under the Emergency Management and Civil Protection Act, and I think they will have to be, they could be fined, and there's a certain a limit of fine. I don't remember that on top of my head, but there are certain limits of fine that they can be charged with. And again, we have said this many times, we don't want to fine businesses, we want their compliance, basically. We want to prevent anything from happening in the first place, rather than something happen and then going back and then trying to fix a problem. So the focus is always public health, is we are trying to prevent that, and through education, we want to make sure that we do not get into the situation where we have to go back and contact trace 50, 100, or thousands of people. We do not want that. We want to make sure that businesses and even the patrons who are visiting these establishments, they are following all those precautions and recommendations and keeping themselves safe. That's the biggest message that I want to give is, before something happens, do your part.
Thank you.
Any questions from Blackburn?
No, thank you.
Any follow-up questions from the Windsor Star?
Yes, it's maybe for Teresa. We had a question from a local sign maker who was wondering about the health unit sign orders for businesses. Are those being fulfilled locally? Do you know if it's a local supplier?
I believe it is local. I know we have a process for our purchasing, so I'm looking over at Mike, our communications manager, and he said yes.
Okay, and then otherwise, how are those signs being funded? Is it provincial funding for the signs that businesses can order for free?
So our funding at the health unit is through the province and the municipalities, and so it'd be funding through that. As well, we are still awaiting further direction from the province, but much of the COVID funding may be 100% funded by the province. So it is, typically public health units are a mix of municipalities and provincial funding.
Okay, and then since you spoke about those signs last week, have you had are they popular, high demand for those?
I know we got a lot of calls, and I'm not sure about, how many, but I know that after this session on whenever it was announced that we did get an influx of calls. And so probably they're being used appropriately and are a good resource for businesses as they reopen.
Okay, thank you.
Any further questions from CTV?
Yes, Dr. Ahmed. So I know a lot of the conversation lately has been focused on back-to-school measures. I'm wondering, how far ahead are health unit officials thinking? Because I know, the fall is right around the corner, cold weather. I know we're still in summer, but I know you have to stay ahead of the curve and ahead of everything. So how far ahead are you guys?
So I think we've got some good learning from our local experiences, looking at how COVID spread across our communities, some of our key challenge areas, and what we want to see that, all the work that we have done in those areas, they continue to be maintained. There's always this risk of something new that may come up, but what we can see is the education, the recommendations, the restrictions that we have been following for the 6 to 8 months now in this pandemic will help individuals to change their behavior. We are living in a new world right now with COVID amongst us, and the only way we can fight this virus, which it spreads pretty quickly, is by changing some of those behaviors. So it's trying to staying ahead of the curve. It's all of us our responsibility as individuals, as businesses, as a long-term care home, retirement home, farms, all these areas, they all have to continue to maintain all of those measures. And I think we have done a pretty good job in having some of these good systems in place. And some of the markers that we can see is, even if you recall right from the beginning, long-term care home, we've seen a large number of cases. And then when we worked with them, we paid more attention to ensuring that they have good, strong policies in place, and a system that can trigger an early identification of cases and then control measures. So all of those measures are, knock on wood, are working quite well. And we just want to see that those are the two major places where we definitely don't want to see new COVID cases. School is definitely a place where we don't want to see COVID cases, but we also recognize that once the school opens, we may see some COVID activities. So and I won't mince word in here. There will be cases, and we just need to be careful. We just need to be mindful. And as a parent myself and others, it is our responsibility as well that we are keeping a close eye on our children. Our children, whatever we are telling them, whatever we are teaching them, that's the way that they will go and behave in school. The school board themselves or the teachers themselves cannot take all the responsibility to ensuring everyone's safety. They have to have good policies in place. They have to have all the right things in place, but we cannot underestimate how important our role as parents is in sending our kids and ensuring that we are doing our part to give them the right training, give them the right education, and ensuring that if they have any signs, any symptoms, they are staying home. They are doing their symptom checks regularly, daily. Everyone knows their kids. Some kids have chronic cough. That doesn't mean anything. They can still, it doesn't mean that they have COVID. They can still go to the school, but there will be something unusual in your child that only you would know. And those are those signs, those are the triggers that you have to look at. You have to make sure that you're not only keeping your child safe, you're also protecting others. So I think we all have to recognize that there are definitely risks. We're trying to stay ahead of the curve. We are trying to make sure that we are giving all the tools, all the education, all the resources, all the support to everyone in our community. But we're all in this together, and we have to continue to work together.
Okay, great. Thanks for that. Have a good day.
Thank you.
Any further questions from Windsorite?
No, thank you.
CBC?
No, thank you.
AM 800?
Just going back to Windsorite's first question in regards to the event that's happening on Saturday at the mall, will the health unit have bylaw enforcement officers out there? Will you be in contact with the city to have their enforcement, and who knows, Windsor Police?
Yeah, we typically have done that we have worked with our local area police in these type of events and did some proactive work there. And again, the idea is we definitely do not want to penalize anyone, but any disregard of the applicable law, it is a concern. And we definitely want to make sure that the police, the bylaw, our people, they're all working together to keep our community safe. We definitely don't want to see any cases. We definitely do not want to see any disregard of the law as well.
Thank you. Have a good day.
Thank you.
Any further questions from Blackburn?
No, thank you.
Thank you, everyone. Have a good day.